So we're holding about 13 confirmed positive tests of COVID-19 in Talbot County. We still have the one positive death that we know about. We're still doing very well with our feeding program. We still have feeding going on at all of our schools, as well as pop-up feeding at the senior center and at the neighborhood service center. Also, a number of our churches in the county are also doing feeding programs as well. So the feeding program is doing very, very well. Of course, the need is great. So they're trying to make sure that we have enough food to go around to meet the need.
How is Shore Regional Health and Choptank doing?
They do report out every phone call that we have. We have a Monday, Wednesday, and Friday operational phone call in which Shore Health, and Arundel Medical Center, and Choptank Community Medical are also on that call, and they do report out the number of tests that they have taken within their network. Choptank is still testing as well, and they, I believe, are running into the same problem that a lot of medical institutions are running into, having enough PPE for their staff, having enough tests to test the people that they come in contact with, and then I believe probably just the wear and tear that they're seeing on their frontline workforce. These doctors and nurse assistants and doctor's assistants, they're putting in a tremendous amount of time, and this is very stressful when you're dealing with a disease that's so communicable and that's so contagious that you have that same fear of bringing that home on your clothing, or God forbid that you have become exposed. So I think they're doing the best they can do. Let me put it that way under the circumstances.
I guess it's good news for Talbot County that the number has stayed the same.
You want to take any silver lining out of this is that we have been still hovering around that same 12 to 13 positive number. Again, if you talk to Health Officer Dr. Frida Wadley, she would say that number is very suspect, because as we started out in this interview, we just aren't testing as robustly as we need to get a true count of how many exposed individuals we have out there. Right now, the main thing that we're trying to get people to do is that if they go out in the public, is to wear some type of a face masking. It doesn't have to be an N95 mask, as we said before, because you probably are not going to find those out there, but it can be any type of a scarf or lightweight material.
The other thing that we heard last week was that we're probably in the area of 17 to 18 million unemployed. And I wanted to know if you're seeing the local impact.
Yeah, I would have to contact Cassandra Van Hooser, Tourism and Economic Development Director, to probably drill down and get the local numbers from the state. I don't know whether those numbers have been readily available right now, but there is an impact. I mean, if you just go around and drive through town on your business, you will see the impact on some of our stores where they have closed up because they're following the governor's directives. Those stores that are open and still trying to operate are doing very limited business. I would probably say anecdotally, probably a fraction of their normal business coming through their doors. So we don't have the actual numbers in hand, but I mean, just looking around town, and I have not driven through St. Michael's or Oxford or any Trapp or any of other municipals here in the county, but I would say that they're probably seeing the same effect.
Corey, how do you think the energy level is in terms of those who are on the front lines?
It's wearing. It's concerned, and there's a lot of concern there. Again, this is something that none of us have experienced before. When we're dealing with a virus of this type, you know, you always have in your back mind, you want to go to work, you want to do what you need to do, but at the same time, you do understand the risk that's involved with that. So, we're trying to stay in contact again with Anne Arundel, with Shore Health, with Choptank, to make sure that their frontline personnel are also getting the attention that they need. Through our virtual EOC, we have Beth Ann Langram, who is there for mental health counseling. We started our meeting off on Good Friday with Sue Browning, Reverend Sue Browning from TACO. She started that meeting off this past Friday with an opening prayer. We had about 60 agencies and partners on that phone call that were able to hear that opening prayer of comfort that she gave to us. And I just want to thank her for giving the time to do that for us. So we do understand the emotional and the spiritual wear and tear that this is putting on our work staff, and we're trying to be very responsive to that.